for now, it's time for me to say goodbye to bedside nursing.
If you see the homies with the guap, with the knots in the rows, that's how.
What specialty am I now transitioning to? What's good, you guys? This is NWA here, Nurse Pat. Come for the nursing, stay for the heat. If you guys didn't know already, I got my new grad job as a float pool nurse, and I've been working for a little bit over 3 years now. The current units that I have experience in is medical, med-surg ortho, med-surg oncology, telemetry stroke, inpatient acute rehab, and pre-op short stay. Although I enjoy working with great people in all these units, I decided I needed to take that leap to further my own career. I don't regret working for the float pool at all as a new grad. In fact, I'm glad I did. I found myself being able to learn a much more broad range of skills and critical thinking than some of my other new grad peers. Randomly this year, I saw in my work email that my hospital was offering transition programs for different specialties. So I interviewed and got an offer for both the ED and the OR. Now I know they're both incredibly different, but I felt that there was great opportunity in both. It was an extremely tough choice for me to make. I spoke with numerous individuals on their opinions, and it took me days to make a decision. It was driving me nuts, but it was a good predicament to have. I felt extremely blessed to have those opportunities because there was for sure more experienced nurses that interviewed with me, and they didn't get an offer.
It should have been me, not him!
Well, I know for sure they salty and confounded with that.
This shouldn't be happening. I don't understand. I am a super elite.
For interviews, I always try to prepare myself and show myself in the best light. I try to show them that I have the personality, I'm eager to learn, and I have what it takes to be a part of their team. So what did I choose?
Drum roll, please.
I ended up choosing the ED. Now, I'm extremely excited to grow as a nurse, yet super nervous at the same time. I know for sure I'm gonna have stressful AF days.
I am having a very bad day. I am in no mood.
Working in the ED, and I'm just gonna be thinking to myself, maybe I should have took that OR position. However, for the ED, the growth and experience will be immense. So what are some pros and cons that are going through my mind when I was choosing the ED? One, the opportunity to grow in both critical thinking and nursing skills. Now, literally every day you're gonna be doing skills like IV insertion, edgy tubes, Foleys, etc. Now, although I'm competent with doing these tasks, I wouldn't say that I'm an expert with it. Ooh. Oh, your veins kind of rolling on me. Yeah, I didn't get your veins kind of rolling on me. Ooh, we got some fragile veins here.
It's 90% bullshit, but it's entertaining.
2, I'll have a higher sense of working with these critically ill patients, the ability to stabilize them, or also just working as a team to help others resuscitate a patient that's crashing down. Throughout my 3 years, I actually have not experienced a resuscitation and going through a code. 3, you have that adrenaline rush and excitement. 4, fulfillment as a nurse in general and challenging myself. I floated to the ED once as, extra helping hands, and just seeing the nurses there, how competent they were, it was really inspiring. I thought they were badass. I was like, yo, I'm trying to be like that too. 5, life skills. So working in the ED, in my opinion, will enhance your ability to recognize emergent situations when it comes to your family and loved ones. You'll be able to know what to do and intervene right away. 6, the ability to transition and move to almost anywhere you want. They always say when you have this type of critical experience, it's easy to move a different position. So someday if I decide that the ED really isn't for me, or I just want to chill, I can go most places. Maybe I could even revisit the OR if I wanted to, and they had a transition again. And lastly, this will be 3 12-hour shifts. I've always wanted to experience what it'd be like having 4 days off in a row. Currently, right now, I'm 4 8-hour shifts. Now, it's important to get into the cons. 1, it could be a high-stress environment. Burnout and stress is such a big thing in the ED, and nursing turnover is huge. I feel like I'm seeing reports from ED nurses that I haven't heard of, and it's like they're changing all the time. That's kind of a sus sign. 2, The priority as an ED nurse is to stabilize the patient and send them off to their respective units. Their role as an ED nurse isn't technically to fix or treat. That is the job of the floor nurse. 3, we don't see the progression of our patients because we have to ship them out. We don't see if they're doing good or anything. We don't see the overall trajectory of the patient. 4, this was a big one with my opinion and also other people's opinion, is the uncertainty of getting exposed to many infectious diseases. The ED is sort of the port of entry to the hospital, and we can have patients that we don't know what's going on with them, but we're working on them, we're treating them, we're in there, and then out of nowhere their test results will come up and it'll say that they're contagious with something. Now, especially with COVID, this is kind of a concern. And piggybacking off of that, the 5th con is that I'm probably going to be wearing an N95 for most of my shift as long as this pandemic is going on. Thankfully, I'll be getting my 3rd dose of the Pfizer vaccination, so that's a booster shot, so I'll have a little bit more peace of mind. And then the last con for me is that I am going to be night shift. It's going to be 7 p.m. to 7 a.m. and my sleep is going to be all out of whack. So when do I start and what am I trying to do to prepare? The training program is a 3-month program, which is very generous in my opinion, and it starts October 3rd. Reading EKG rhythm strips is not one of my strong points, even though I trained for tele, because when we're working on the floor, we have monitor techs that generally look at your rhythms all the time, and they let you know if something funky is going on. So it kind of acts as a crutch for the nurses because they get a little bit too dependent on the monitor techs. It doesn't allow me to fully practice my skills and recognition. So what I'm doing is I'm trying my best to allocate maybe just 20-30 minutes out of my day just to do some practice rhythm strips. Because in the ED, we do not have the luxury of the monitor techs at my hospital. If something's funky going on with the patient, it's on us to recognize what's going on and intervene promptly. So while I was editing this video, I just noticed that the rest of the footage got cut off because I had a lack of memory in the SD card. Such a noob. Anyways, I'm gonna finish it up here. Continuing with what I was saying is that I'm also gonna be reviewing my PCCN study material because it had a lot of critical diagnoses and situations and also interventions that I might need to brush up on. Something I also need is the PAL certification. So this is a Pediatric Advanced Life Support. Preferably they wanted me to start the certification and finish it before the training, but they're also willing to do a time during the actual training. Now, I'm not used to working with babies or kids. I'd be more terrified of the parents, to be honest. I'm also going to be keeping an eye on the ED track board, which basically shows certain things going on in ED, how many patients they got, what are the diagnoses of these patients. So I'll kind of see general demographics as well as something I might see on a daily basis working on the department. In terms of 12-hour night shifts, I've been preparing myself by speaking with a bunch of friends and coworkers on how they manage their sleep quality and time, as well as many different YouTube videos, because I really want to make sure I got my daily routines on point. I want to be able to keep doing what I do, keep working out, and keep socializing the way that I am right now. So yeah, that's my update for you guys. I'm excited for this new career journey. I'm about to feel like a new grad again. Let me know what you think. What do you think about the ED? Are you someone that already works in the ED? And let me know if you have any questions. Maybe I'll vlog about my journey, who knows. Hope you guys enjoyed the video. Comment, like, and subscribe if you're feeling the content, of course. And as always, stay safe, stay humble. I'm out.